शुरू करें? Bismillahirrahmanirrahim. Today we will discuss monkeypox. My name is Professor Dr. Hussain Baksh Kolachi. I am Professor of Community Medicine and Public Health at ISRA University, Hyderabad. Before it, I also worked as a dean in ISRA University, dean in Liaquat University of Medical and Health Sciences, Jamshoro, and chairperson, International Medical College, Dow University of Health Sciences, Karachi. And I am fellow of College of Physician Surgeon. And my experience is about 30 years of community medicine and public health, and my interest is particularly the rural health, desert health, and research in emerging and re-emerging infection, just like monkeypox is again an emerging infection. So let us start without wasting time. But before that, Dr. Hussain Baksh Kolachi YouTube channel will provide you update and authenticated information, and it will be useful and beneficial for general public, medical students, medical faculty, and people who are interested in public health field or in a research. So monkeypox is an emerging infection. Nowadays, most of the print, electronic, as well as the government channels and government officials, WHO, National Institute of Health, CDC, they are discussing this disease with a great concern, and there is a scare or a fear or a specter of this disease that it may spread very fast, because already people are feeling the great danger from the uh, recently pandemic of the COVID-19. So this is the picture of monkey pox. You can see that it is oval shape, and sometimes it is called as a brick shape virus. It is a large virus, and it is a DNA virus, while the COVID and even the lumpy skin disease, that is a Capri pox virus, recently emerged in the cattle of Sindh and Pakistan, was also a viral disease. So coming to the monkeypox, WHO has already, you can see there is a WHO monogram, as well as there is a red alert on the slide. So coming to the monkey symptoms, because most of the general practitioners and friends, they are uh, they are interested in monkeypox symptoms. So almost 8 symptoms are very common, and you can see that rashes on the skin, fingers, forehead, and overall body are the main symptoms. That's why it's called monkeypox was. There is a history that why it is called monkeypox, because in African countries, particularly Zaire and Congo, this disease was identified or seen in the laboratory primates or monkeys. It was a pox-like symptoms, means skin rashes, eruption, fever, and other symptoms. So the name was given monkeypox in 1958, but it was an animal disease, and it was not known in humans. But in 1970, this disease jumped from animal to human side, and since then we are worried about this. And recently, at least 12 to 15 countries of the European, in which UK, Australia, Germany, and other countries are facing this problem. So symptoms are, they start from skin manifestation or eruptions or rashes on the forehead and then come down to the body, and ultimately they emerged into pustules and then scabs, and ultimately they are uh, shed off from the skin. So this is a pattern of the rashes. But apart from this, fever, headache, swollen lymph nodes is a very clinical signs which our GPs and medical students should be of careful. Muscle ache, backache, a painful rash which turns to scabs. You can see here, this is a painful rash, and the chills and exhaustion, these are the few symptoms. Then coming to the Pakistani situation, this has been reported on 7th May 2020 in UK and other European countries. But today, when I am talking, it is 28th. So in last 15 days, no case so far has been uh, confirmed in Pakistan, but there are suspected skin eruption cases. Sometimes they are admitted in the National Institute of Child Health Karachi, and also National Institute of Health and other hospitals in Islamabad and Lahore. But the diagnosis of these infections uh, uh, is made or are made as infectious dermatosis or skin eruption, not confirmed by the laboratory test. So far, Pakistan is trying to secure or to obtain the uh, PCR kit, which can diagnose within a 1 hour time, because PCR machines are available, only kit is missing. So WHO and other international organizations are being requested. So here is that two children were found with skin rashes and blisters at the National Institute of Child at Karachi, who were shifted to isolation ward following scare among parents of children admitted to the health facility. So from this, you can understand that how much is the problem. Coming to this, this is a news item. It is also emerged that most of Pakistani laboratories, including National Institute of Health Islamabad, our Khan University, Karachi, and the University of Health Sciences, lacked the ability to detect the monkeypox. So we need to upgrade our laboratory system on a war footing, and I think Ministry of Health, Dr. Azra Picho Sindh has already mentioned that the alert is on the entry point in airports, and same the whole country air travel is being uh, the surveillance is there, and patients are checked for any symptoms or any other suspected case coming from the countries where monkeypox is nowadays. So another children or child from Ladkhana and one adult also, the photograph is published in local newspapers with the skin eruptions similar to the cowpox not, but a monkeypox. You know that this pox word is very familiar with the smallpox, because that disease remained from the antiquity till the 8th May 1980. 8th May 1980, when WHO declared that smallpox is eradicated from the world. And after this, the pox word was used for cowpox, camelpox, horsepox, monkeypox. So pox is basically a skin manifestation, a viral disease. because of the smallpox and its long history, and its vaccine is still effective. I will discuss in detail in some of the upcoming slides. So, friends, Dr. Hussain Baksh Kolachi YouTube channel will provide you new and updated information. So please continue to be with this presentation, and I shall request that for updated information, like it, visit it, and subscribe it, and also share with your friends. Coming to the monkeypox or animal origin of the disease we call zoonotic diseases, and you can see another picture, the skin eruptions on the foot, hand and skin of the hand or the lower arm. And this is how the monkeypox is diagnosed in the laboratory, and this slide shows actually a detail how it is spread. It is spread at least through scratches, through bites, through eating some material of the infected animal, whether it is a meat or anything, and even the clothes, uh, which are fomites basically. If they are infected or contaminated with the monkeypox, they can also spread. So during the laundry, one should take care. And then is the droplet infection or human to human contact. You can see here that these are the two people, and if the distance is of 6 feet, then you can be saved from the monkeypox. This is a microscopic or laboratory picture, how it looks like. And if you can see that the brick-like structure which I mentioned is there. So another manifestation of the face. This is a picture which is available, and these are the countries where from on the world map you can see that the country of origin were in Africa, but now it is in Europe, America, USA, and cases are more in some countries. In one country, these are 50, 34, 20, but in some countries 22, and there are one or two cases of in many other countries. So this map gives you some idea that how, and mostly these are non-endemic countries or where this monkeypox was not there. So how to deal with this problem? There are no specific treatment available for monkeypox infection, but monkeypox outbreak can be controlled by smallpox vaccine and antiviral Cidofovir ST246 and vaccinia immune globulin or VIG can be used under a supervised and qualified or a recognized center by WHO or the government authorities, just like NIH and other tertiary care, university level or medical college level hospitals or government hospital which are designated. CDC guidance was developed using the best available information, and there is a reference also. You can see the details. This is a smallpox vaccine which is 85% effective against this monkeypox, and in UK, the healthcare staff of the hospital is recommended to get the shots of the smallpox vaccine. This is once again the same picture which I have shown. These are the few other vaccines, Jynneos and other Immuno or Imvanex. These are the names, Imvamune or Imvanex and Jynneos is another vaccine which is used and licensed for the monkeypox. And you can see that at least the research shows that it is effective smallpox vaccine in Africa. And some of the people have also shown the antibodies against monkeypox because smallpox vaccine can generate the antibodies which are also effective against the monkeypox, though they are specific for the variola virus or smallpox virus or vaccinia virus. Coming to the further eruptions, and then you can see that how monkeypox name was uh, identified and how uh, immunoglobulin or VIG vaccine immunoglobulin can be given. This is another modern is also using its technology and platform to bring another vaccine soon. So monkeypox is a zoonotic virus that spreads mostly among animals, but has been endemic in few countries in Africa for a number of years, including Nigeria, Democratic Republic of Congo, which is the central alpha point of and Central African Republic. You know that this Omicron is more also coming from the South African region. So these are the area where Democratic Republic of Congo, formerly perhaps it was called Zaire. So I think we have almost completed. The R not in public health we use as per the MedCram expert Dr. Schulhetz. The R naught of the monkeypox is 0 to 1, it is less than 1. So there is a likelihood that it will not be spreading just like COVID and other pandemics, but it will be locally endemic disease or can be at least an outbreak in certain countries. And you have seen that 50, 41, 2 cases are confirmed. So with this, I think the prevention, the hospitals should have a full infection control. The community should have a full awareness. There any sick animal with a skin infection or any patient with skin infection should be carefully evaluated clinically as well as from the laboratory point of view. Children are suffering more from such viral diseases, so they should take care of these viral infections. Uh, uh, then the immunity as well as the hygienic measure, which include the rest, clean water, hand washing, social distance, use of mask because it is a droplet. Another point is that one of the root in UK is in the gay community, or it is just like a hepatitis STD. So people should take care of such behaviors so that this disease is not spreading through any route. And if your immunity, hygienic condition, hospital infection control, use of vaccine, which is available, antivirals are available, and naturally this is not mutating much as the COVID and other diseases or RNA viruses are mutating. So hopefully, and in Pakistan, when I am recording this on the 28th, no case has been confirmed laboratory. Only suspected or probable cases of skin infections are reported. But we, through this lecture, request to the medical students, public policy makers, and the health delivery system, they should have the isolation wards as well as the international guidelines. National Institute of Health Islamabad has a great responsibility. The ISRA University as a social responsibility and medical care provider, top ranking facility. We have a big hospital in Islamabad, Karachi, as well as in Hyderabad. So all the people are informed that this disease is not in Pakistan, but it is in many countries of the world. So travel and the intermixing of the population, and as well as we have many relatives, friends in other countries. So there is a high risk that this disease may enter into Pakistan. I will request the local bodies for cleanliness, clean water supply, as well as the rangers, armed forces, medical health delivery system, provincial health delivery system. They should coordinate and defeat the monkeypox. I am sure that you will like this lecture, and you will see more videos and more lectures on Dr. Hussain Bashpolachi YouTube channel. Thank you very much.